Hello guys, this is team code not red. A special welcome to the patients who are suffering from diabetics. My teammates will give you a brief explanation about this.
Diabetics is a condition where the body is unable to regulate the amount of glucose in the blood due to lack of insulin or the body's inability to produce insulin. A condition where there is too much glucose in the blood. Diabetics is referred as a chronic disease characterized by high level of sugar in the blood. Diabetic causes vary depending on your genetic makeup, family history, and environmental factors. There is no common diabetic causes that fits every types of diabetics, as the causes of diabetics vary depending on the individual and the type. But the following triggers may be involved: viral or bacterial infection, chemical toxins within the food, unidentified component causing autoimmune reactions. Symptoms of diabetics include increased thirst, hungry and urination, blurred vision, numbness in feet or hand, unexplained weight loss. Some people do not find out they have disease until they have diabetes. Related health problems such as blurred vision or heart trouble. It's important to talk to doctors if the person has these symptoms. India is diabetic capital of the world. India is the one of the biggest population nation on earth, in which survey ensures that over 30 million people including adults and elderly have now been diagnosed with diabetics. In rural areas the prevalence is approximately 3% of the total population. The urban areas it is expected to be 9%, as you can see in the graph of our slide. There are currently three methods for determining a diabetic patient's blood sugar level. They are invasive, minimally invasive, and non-invasive. Invasive method involving entry into living body, accurate and painful process. Minimally invasive method involving entry into the body through small incision. It's stable and high risk of infection. Non-invasive method that does not cut the skin and enter into the body, painless and infectionless process. Persons suffering with diabetics have to constantly monitor their blood sugar level and take insulin accordingly. Process of checking blood sugar level by invasive glucometer method is: wash and dry your hands well, because food and other substance can give you an inaccurate reading. Insert a test strip into your meter. Prick the side of your fingertip with a needle provided with your kit. Touch and hold the edge of the test strip to the drop of blood. The meter will display your blood sugar level on a screen after few seconds.
If we will see pricking part, finger prick device pierce the screen with a needle so that a drop of blood can be taken for testing. It is adjusted that how far it goes into the skin because it depends on the thickness of the skin. The process of piercing is little painful and it is not only suffer that once in a year or in a life. According to 2015 NICE guideline recommended that people with type 1 diabetes test their blood glucose at least 4 times per day, including before each meal and before bed. If any person have type 2 diabetes, your healthcare provider may recommend blood sugar testing several times a day. Pulse oximeter is a non-invasive test that measures the oxygen saturation level of your blood. It can rapidly detect even small changes in oxygen level. These levels show how efficiently blood is carrying oxygen to the extremities furthest from your heart, including your arms and legs. The pulse oximeter is a small clip device. It attached to a body part, most commonly to a finger. Medical professionals often use them in critical care setting like emergency room or hospital. Some doctors such as pulmonologists may use them in office setting. We can even use one at home.
Regular blood sugar monitoring is the most important thing you can do to manage type 1 or type 2 diabetics. You will be able to see what makes your numbers go up or down, such as eating different food, taking your medicines, or being physically active. Within this information, you can work with your healthcare team to make decisions about your best diabetics care plan. This decision can help delay or prevent diabetics complications such as heart attack, stroke, kidney disease, blindness, and amputations. Your doctor will tell you when and how often to check your blood sugar level. It may prevent hypoglycemia or hyperglycemia in future. Glucometer are invasive and the process is painful till date. Having a glucometer just like pulse oximeter, which non-invasive and accurate, is a big requirement. A compactable and a battery operated device is not feasible. We have seen devices like pulse oximeter which are convenient to use and give accurate reading for oxygen levels in blood. Having a glucometer just like pulse oximeter which is non-invasive and accurate is a big requirement and has a huge market. The challenge posted is for having a glucometer just like pulse oximeters. Addressing those demerits, we will provide a pathway to develop a portable and non-invasive device where people can carry anyway and also usage of rural people can easily accessible. Being considering the benefits of non-invasive devices, it will aid a painless procedure to determine glucose level in blood additionally. The development of a genuine non-invasive device for glucose measurement would represent a life-changing factor for millions of patients around the world, allowing them to monitor their glucose level confidently and receiving quick treatment if necessary. It also represents a vast potential market. The device should be able to accurately measure the blood glucose level of the user with the results compared to the traditional methods such as finger pricking. Results of the blood glucose measurement should then be displayed on the Android device loaded with an Android based mobile application system.